sexual and reproductive health rights are critical entitlements best supported through human rights-based approaches, empowering rights holders to claim their duties and rights and duty bearers to bear and fulfill their obligations. Implementing these requires information on the current needs and challenges faced by those seeking to claim their sexual and reproductive health and rights. In Uganda, there is still a struggle to access the sexual and reproductive health and rights. However, as Walter Mwesigye reports, not all is lost since policies have been formulated and await committed enforcement. Here is more in our Health Focus.
Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The discussion around access to sexual and reproductive health rights is not new. For years on end, several voices, spearheaded by non-government organizations, have put forward the purpose of having young people understand their sexual and reproductive health rights.
What is missing is us failing to understand that the situation is here with us, and it is us to address it, and address it in our context, and address it realistically without having to run around shouting.
The contention, however, is majorly on the kind of content that the young people will be given whilst trying to protect them from things like early sexual encounters and related effects.
Teenage pregnancies, forced marriages, and lack of centers or services centers where young people can access services are all key gaps that have sort of mushroomed or been amplified.
But experts say the fear of the unknown is not helping, because approximately half of all pregnancies among women and girls aged 15 to 19 years are unintended.
When we had the COVID case, one like this, we declared outbreak of COVID. I'm wondering why we cannot declare outbreak of sex. Outbreak of sex in this country. 1,052 is alarming. If you look at the number of the maternal mortality rates that are likely to come out of this, it's quite alarming. I make this statement as local governments, we feel the burden of SRS challenges the most.
The suggestion, therefore, is to ensure that young people have access to age-appropriate, comprehensive sexuality education, as well as high-quality sexual and reproductive health services.
Much as we are talking about HIV, we should understand what is causing the young people to get pregnant. What is causing the early child marriages? It will come back to poverty. And we are challenged that any intervention in SRHR, can it have the aspect of something that is empowering the young people? Because even if we talk about this, like choices and the planning and the services, and when they have nothing in the pockets, they will still go back to doing what we don't want them to do.
People are not going to bring for us the solution, but as a country, we have to discuss and have a local solution.
So as parents or as cultural institutions, as cultural leaders, we need to go back to our families. We need to tell parents to talk to their children to start as early as 5.
As a ministry, we have guiding documents. We've come up with a second strategy to end child marriage and teenage pregnancy that we were to roll out. We launched it during the Day of the African Child commemorations. And then now we have the coordination mechanism that is to enable us all the actors work together, work and deliver as one, because you can't do it alone. The MDS can't do it alone, the leaders can't do it alone, even the actors in this space can't do it alone.
And the affected young people should be helped to live a reasonable life, according to the experts.
Now that they're mothers, what do we do? Because you can't change that. They're already mothers. We're addressing those issues. For example, we are integrating them back to school, supporting them, making them have a chance that there's still life after this child. Because this child must have a good future. Making sure the youth understand shared information and shared reasons for what their action can result to. We have also given access to justice. They want justice. How they get it, we give them reasons so how they can get that. Also access to God. If you have access to God, then you know that you are right, aligned to the right path. We also we ask them that girls must be in school. We protect the girls' rights. We say, what is the girl supposed to have? We also deal with child rape. We don't pass laws. We refer them to police, to the courts. But there's what we call healing. That healing in the home. When rape has happened, there's always a tension in the two families. We as cultural people trying to make that the two cultures continue to coexist, but let the culprit be punished by the law.
Taking a comprehensive approach to the provision of sexual and reproductive health services for adolescents would yield immense health benefits and also help achieve a better demographic dividend. Walter Mwesigye, NTV.